it doesn't have to be all or nothing, right? So even if they could latch once a day or pump once a day and still provide that kind of reduces a lot of the guilt for the mom, right? And if that's still causing a lot of mental health issues and just allowing them not to be a mom or like a fully functional adult, then I say stop. It's just not worth it. I'm sure the baby would prefer that a mom is actually a happier mom than to push through with breastfeeding.
One of the things that breaks my heart really in clinic is when you see women who really, really wanted to breastfeed and for whatever reason they've had to give up. What's your message to these women or anyone out home who feels that way? What's your message to them?
Breastfeeding is not just the transfer of milk. Breastfeeding is the transfer of love and comfort and security and all of the other things. So we sometimes call it chest feeding, where you're actually being skin to skin with your baby and giving them a bottle. And that's also breastfeeding, I feel.
Yeah.
Right?
Yeah.
So I think there's so much more to breastfeeding than just milk.
Welcome back to the Women's Handbook podcast, where we talk about women's health from menarche to matriarchy. I'm Dr Natalie Hutchins, and today we're talking about breastfeeding. Now, this is one of those subjects that can feel really polarizing. For some women, it is beautiful, it's instinctive, it's really easy. But for others, it can just be incredibly difficult, and women can feel inadequate or full of misplaced guilt if it doesn't work out. And I think part of the reason for that is that we know that breastfeeding does have a lot of benefits. But modern motherhood just really doesn't feel that well set up to support it. We've got minimal maternity leave in some places, terrible postnatal support, the pressures of work on top of broken sleep. It can all just be a bit too much for some women and not very good for women's mental health. And of course, that's not good for breastfeeding. So we're going to get into all of that. And to do that, I'm joined by Dr Mythili Pandi. She is a family physician and a certified lactation consultant. We're going to talk about the physiology of breastfeeding. How do we actually produce milk? What the evidence shows about the benefits and what we can do when it doesn't unfold as planned. So let's get started. Hi, Mythili.
Hi. Hello,
Thank you
Natalie.
so much for coming in.
It's an absolute pleasure.
Yeah,
Thank
I'm really
you.
pleased to have you here. So, Mythili, a lot of GPs have got specialist interests in things, but it's very rare to find one who is a lactation specialist. So tell me how you got into that.
I think it all started after my first birth. I had a beautiful birth and the natural extension of things was breastfeeding. And I really enjoyed the ease of travel, just exploring the world with my little baby in my hands, just being able to do it all just with having sustenance through the breast. And I had really good support. But I feel like I was one of a very few. And when I then realized how much trouble a lot of women were facing with breastfeeding, I felt like I could do this. I could help a lot of mothers. I was actually part of the Breastfeeding Mothers Support Group, which is a local charity here in Singapore.
Right.
And I started working with the organization, started training other moms. And then someone came up to me and said, well, you're doing all of this. Why not become an IBCLC?
Right.
And that stands for an International Board Certified Lactation Consultant. And I was like, more studying. And I think during that period, I was already having babies and, I've had babies in quick succession. And I finally got down to doing it 10 years ago. And here I am.
Okay. So we've got to condense 4 years of knowledge.
Yeah.
Plus however long of experience into 45 minutes.
There we go.
We can do it. Okay, so one thing that just blows my mind is the fact that our bodies can produce milk. I mean, I just think it's just such an amazing thing that we can do if it goes well. How does that happen? Can you explain how that happens, how our body starts producing milk, what hormones are involved? Let's get into it.
Right. So right from the start of the menarche, we start producing these breast glands, and that's how our breasts start growing and things. And as soon as we start getting pregnant, we've got all of these hormones like the oxytocin that might start working. The receptors get planted in. We've got estrogen and progesterone. All of that start working towards getting the breasts the glands starting to work, all the anatomy gets started, and that's why we start to see these beautiful alien looking veins popping out on our breasts. The areola starts getting darker, the nipples start protruding a little bit more. All of that starts happening in the background. Once the baby starts to descend down the uterus and into the vagina and starts coming out into the world, oxytocin's at play. When babies are born, basically the oxytocin starts being produced, right, during that process. And the glands start contracting and the milk starts flowing, and that's how it all starts. So as soon as the progesterone is plummets with the birth of the placenta,
right,
prolactin starts to increase and you start producing milk from the colostrum to transitional milk and then to the mature milk.
Okay.
All of that starts to happen within a span of a week, often after the baby's born.
Okay. It's just so, I mean, it's clearly quite a complex process, but it is fascinating, isn't it? It really is. And I think, as I touched on in the introduction, I think one of the things that can be really devastating for women is when they really want to breastfeed and then for whatever reason, their bodies just don't play ball. And I always think if they kind of understand maybe some of the physiology behind maybe what's affecting their ability to produce milk, maybe sometimes they can give themselves a little bit more grace. Like, okay, it's not necessarily my fault, it's nothing I've done, but it was all these things that were out of my control that led to this situation. So are there any things that around the time of birth or very soon afterwards that can mean that a woman's milk supply isn't as good as maybe it could have been?
Yeah, so if there's birth that might have been a bit traumatic.
Yeah.
So when moms are not feeling in control, and I think you have done a podcast on birthing
Certainly
as well.
have, yeah.
And that was a beautiful podcast.
Oh, thank you.
So when a mom has given birth that might not allow her to feel super empowered, that will have an impact on how she appears to feel and bond with a baby as well. And that would have an impact on her milk production. And if she's constantly stressed, if she's not getting the support that she needs with, family, you can't raise a baby in a silo, right?
Absolutely.
You have to have a whole village behind you. So if that village isn't created, the mom might not be able to produce the milk that she needs as well.
Yeah.
I've seen tons of moms who have given birth in pretty challenging circumstances, twins having not have the birth that they wanted, and their partners have had a challenging time at work, being let off and things like that. And then they have to move houses.
Yeah.
All of that will have certainly an impact on how she perceives herself to be a mom and will also have an impact on her milk supply as well.
Absolutely.
Yeah.
What about things like cesarean sections and blood loss and things like that? Does that have an impact?
Absolutely. So when we have a significant blood loss, a part of the brain doesn't get a lot of the blood supply. We call it Sheehan syndrome.
Yeah.
And that might have an impact on the milk supply.
Okay.
And at least starting the milk supply.
Right.
If there's significant amounts of blood loss as well, as you know, we need iron for all of the body processes. And if you don't have enough iron, then the milk supply also starts to falter.
Yeah.
Cesarean sections, well, if you're in pain, and,
absolutely,
that doesn't help either.
Absolutely.
So if you have a baby who is not latching on well, that also will have an impact on the milk supply, right? And because milk transfer hasn't happened effectively, the milk supply doesn't actually build up to its maximum.
Okay. So we talk about that a lot. I think people have heard, your baby's got to latch properly, you've got to have it in the right position. But like, how do you know? How do you know that your baby's getting enough? How do you know that they're in the right position? How do you know that your latch is okay? How do women know that?
Well, it's actually got to do with how the mom feels.
Okay.
So when a baby's latched on well, the mom often might feel like, hey, it's a little bit of a strong feeling at the beginning, but within seconds, you can see that she's just resting. She's kind of just breathed out, she's exhaled, and suddenly she just goes sinking into the pillows behind her. And then okay, she's all right.
Yeah.
The baby's getting the milk. And we want to listen to babies swallowing. So they're just not sucking, because sucking, you could suck all day if you needed to. But if you're not hearing a swallow, there's no milk transfer. So we want to hear a good swallow after a suckle.
Okay.
Right. So then we know, and the baby starts looking more relaxed as the milk's flowing.
And they open out their hands.
That's it.
Like that.
They open their hands up, and they're really like feeling really heavy on the mom.
Yeah.
All of those things are things that we look out for.
Yeah. Okay. And if you've got a mum who is, maybe she has had a cesarean section, maybe it was an emergency, maybe it was traumatic and she's lost some blood. She really wants to breastfeed, but baby's been taken away to NICU. Do you have any advice there? I mean, I don't know if you ever go into hospitals and do that kind of acute support, but what's your advice to women there to try and, because we've talked about the things that physiologically can reduce a supply. So that mum sitting at home might be thinking, God, if that happens to me, I'm going to find it really difficult. So what could she do in that situation if she doesn't want to risk losing her milk supply?
Well, if the baby's in the NICU, for instance, and the mom's at home, I would say as much as she can, get into the hospital and be really insistent that she gets the skin to skin with her baby.
Okay.
The more skin to skin she does, the better for her mental health. And the milk supply also starts to kick in. It's all got to do with the hormonal processes, right? So the oxytocin starts flowing, and as the oxytocin flows, the prolactin also starts increasing, and her milk supply tends to go up.
Yeah.
We also want her to stimulate the milk supply early. So if there isn't a suckler, a baby, in the presence of the mom in the early days, we want her to start expressing either with her hands or with a breast pump, and that might be quite important too.
Okay. And let's talk about that. So, I mean, we talked about modern motherhood. It's difficult. It's not really set up for mothers these days. We don't have the village that you talked about. So many women are parenting kind of really in isolation with the nuclear family, which is not really how things were intended to be. And one of the responses to that is to share the responsibility with the partner, which is great. And a lot of women need that. But part of that becomes needing that baby to then be bottle fed. So that could be through expressed or it could be formula. And obviously we want to support mums to do that for their mental health. But how does that affect a mum's milk supply?
Well, I think the question really is, how do we support a mum if she needs to not be able to breastfeed her baby in 100%, right?
Absolutely.
Lots of things. I mean, a single drop of breast milk is actually still the process of breastfeeding, and this mom will be considered a breastfeeding mom anyway.
Yeah.
Right? So if the mom isn't able to feed her baby at the breast all the time, that's okay.
Yeah.
Yeah. As long as she's supported, as long as she's getting what she needs, as long as the baby's getting what the baby needs at the end of the day, and she knows, it's an informed decision that she will have to make.
Yeah.
I'm all for that.
Yeah.
Right?
It's like taking the pragmatic approach, right?
That's it.
That it's not all or nothing. Actually, anything that you can do is great. It's amazing.
100%.
It will have benefits, won't it?
Yeah.
Yeah.
A single drop of breast milk is all that your baby needs.
Yeah.
It's not black or white. There's so much of gray in the middle of that. Right?
Absolutely.
Yeah.
Absolutely. If a woman is thinking about it, though, say she does have a choice, baby's not in NICU, baby's with her, and she's wondering, okay, I really want to be able to breastfeed. I want to be able to breastfeed for as long as possible. Should I be expressing and giving my baby the milk from the bottle, or is it actually better just to breastfeed from my breast itself?
I think it's best that a mom is breastfeeding at the breast as much as possible. It's easy for most of the moms, right? Because you don't need paraphernalia, you don't need the breast pump, you don't need a bottle, you don't need the sterilizer, you don't need the teats in the bottles, you don't need all of those things.
Yeah.
But if she needed to head out, sometimes we say, if you just needed to get your hair done or your nails done and you needed to leave the house, then we need to be somewhat prepared for these exigency plans.
Sure.
And that might mean that you needed to express a little bit and offer it with a syringe, a cup, a tube, or a straw, or a bottle if necessary. We try and we often recommend that babies are not given bottles until 4 to 6 weeks post-birth, right? Just because, the mechanism of breastfeeding is quite different from bottle feeding.
Yeah.
It's just a lot faster. It's like driving an automatic car versus a manual car.
Oh, that's a great analogy, yeah.
it's almost brainless. Like, you know what I mean?
Yeah,
right? It's easy.
Yeah.
And so we often recommend that babies are only given that after they learn the manual, right? They know how to do the stick shifts and things.
Okay.
Right?
I also heard that you have babies, when they feed from the breast, they backwash a little bit into the milk ducts, and that is actually picked up upon and it changes the composition of the milk.
it's incredible.
Isn't that insane?
Yeah, it's amazing. And that's how moms make the bespoke product that a baby needs.
Yeah.
You know? So if a baby were faced with a cold, assuming the nanny had a bit of a sniffle and she holds the baby's taking in these antigens into the baby's body. The baby then passes it onto the mom as the mom's breastfeeding. She then processes all of these antigens and make the antibodies for her baby. And so the baby tends not to fall sick. The mom might, but the baby often doesn't fall sick at all.
Yeah, that's so amazing.
Yeah. So if a baby were to be bottle fed then, they still can have that amazing ability for the mom to make that bespoke product just by doing that skin to skin.
Right.
So skin to skin is not all about breastfeeding at the breast.
Okay.
Babies, as long as they have some skin to skin with their moms, they are transferring these, microbiome into the mom, and the mom starts processing all of it.
That's really reassuring, isn't it?
Right?
Like if you can't breastfeed, if you've tried your best and you can't, or if you just, it's not something that's for you, just to know that actually it's not a complete loss, that you are going to get a similar process just through being close to your baby. That's really reassuring.
And it's the bonding, it's the attachment, it's the love, it's the security, and all of these intangible benefits that babies receive just by being skin to skin.
Because that's one of the, I suppose, controversies is that often people will say, well, breastfeeding benefits is about bonding. And then, bottle feeding mums will feel, a little bit alienated by that. Is that true? Is there any evidence that actually just because you're breastfeeding, you're going to bond more with your baby than if you were giving it a bottle?
Oh, that's a hard question, Natalie.
Okay.
I think we cannot quantify how much bonding a baby would get. But I've seen some beautiful mom-baby diets who have been bottle fed.
Absolutely.
Absolutely. I don't think they're second class or anything. I actually think they're bonding beautifully. They're growing up so well. Moms are bonding with these babies as well. So I don't think they're any lesser, right? I think it's how your parenting style is at the end of the day. It's not got to do how you're feeding your baby.
Exactly. And again, just going back to the kind of the modern motherhood idea, we're kind of sharing more with partners, which is absolutely right. It's what we want to be doing to take the burden off of mothers. One of the other things that's kind of a modern thing is feeding to a schedule. Rather than demand feeding. And the other part of that is, which I kind of got into when I had my third child, was kind of wanting to know exactly how much they were getting. So expressing, so I suppose these are two questions here. So one is, feeding to a schedule. And the other one is expressing and feeding that way just because you want to know how much they're getting. Talk to us about that. So talk to us about feeding on schedule.
Well, I find this quite interesting. And I think it's an increasing number of parents who are wanting to know exactly, to quantify the time, quantify the values of the volumes that babies are getting. And every single pee and poo, they're putting it down into an app. And I find this really interesting. I mean, a little bit tiresome, to be honest, but look, I always say, look, when you have a baby, you really just want to kind of usurp a little bit more control to the baby, give them what they need. You want to kind of watch the baby instead of the clock. I often tell parents, look, I'm not really interested in how long the baby's feeding at the breast because they're not constantly feeding. They might be suckling and taking a break. And how do you quantify that time that they've taken they're just chilling, basically? Right? I often say, watch the pees and the poos. As long as you're making enough pees and poos, I'm okay with that. I don't need to know how much time they've spent sleeping. I don't need to know how much awake time they have and how much time they're spending in one breast and then the other. And so that allows them to have a little bit more grace. They can rest. They can enjoy their baby and not just, stare at this little mechanical phone every single time they need to do something. Or the baby opens their eyes and then they're like logging that in as well. And it's just too much.
It's difficult, isn't it? Because we have grown up in a society which tells us that we can control everything. And then when we feel anxious, we don't know what to do. It's our first baby and we're feeling anxious, then actually some of that response is control and schedule and know and exact. And actually a lot of motherhood, a lot of breastfeeding certainly is about relinquishing control.
Yes.
From you to the baby, seeing how things unfold, right?
That's it. And trusting the process.
Absolutely.
I often use that phrase, and I think it does ring. I think it rings true. To be able to trust that the baby will tell you what the baby needs at the end of it.
What about those situations though when the baby doesn't tell you what it needs, right? And you are doing it intuitively, but baby's not gaining weight, things are not going as well as they should, and you know that intuitively. What then? So what should women be doing? So first of all, how do you diagnose that you don't have enough of a milk supply? So if you think, gosh, this, I'm doing it intuitively, I'm feeding on demand, I'm still doing some night feeds, I'm doing all of that, but just, this baby doesn't feel satisfied, always seems hungry, that I'm not getting any of those signs that he or she is actually taking in enough. How do I really diagnose that?
Well, then we would have to go back and watch the pees and the poos.
Okay.
If the baby's making enough pees and poos, then it's something else going on there.
Okay.
Right? If the baby is appearing to be in pain, for instance, then we need to kind of figure out what's going on there. It's hard to diagnose these issues until I see these moms. So I would say if you're breastfeeding and you're finding something's not quite right, you might need to go see an IBCLC to try and figure out what else is going on.
Okay. Right? So let's talk about the baby that definitely, or some of the causes of a low supply. So, and maybe this one is a bit controversial, but tongue tie. So if I think one of the things, certainly when I had my sons, they weren't latching properly, and the first thing midwife did was look in the mouth for a tongue tie. Now, I know that's very controversial as to whether it really does cause problems.
Oh, it does.
Okay, there we go. So let's talk about that.
Okay, so a tongue tie basically means that the baby's not able to lift their tongue and press up against the palate. So basically the nipple goes between the tongue and the palate. The baby forms a seal, and then the back of the tongue drops to create a low pressure system, and then milk starts to flow. And that's the mechanics behind it. So if the baby isn't able for whatever reason to lift the tongue, now stick the tongue out, but actually to lift the tongue up against the palate, then we can kind of figure out that this is a tongue tie. And when a baby has a tongue tie, moms are going to be in pain when they're latching the babies on most of the time. It's often a fit issue. So if the mom has a nice long stretchy nipple, then and the baby has a bit of a tongue tie, that's not much of an issue here. Right? But if the nipple and the tongue don't quite match, then we have an issue. Can't do much about the nipple, but we can do something about the tongue.
There is a school of thought that says that tongue tie isn't necessarily the main issue, or am I wrong in that?
It's hard to really say this out loud, to be honest, because I think you really have to make you have to watch the whole thing happening and
it's
unfolding.
about the whole picture,
right? Most of the time, what I would often do is we try and work with these moms on the different positions, right? Not fighting gravity, but using gravity. So plastering the baby onto the breast, allowing the baby to get a really nice chin lift and, get a good seal at the breast. Take as much breast tissue in the mouth as possible before we decide that this is not working. There are tools that we use as well sometimes, like nipple shields and things to kind of help
How does that help?
It kind of allows the nipple to be a little bit more elongated.
Right.
And so then the baby kind of gets a good latch onto the nipple shield. And then they suckle. And they often transfer milk much better as well. So there are tools that we use sometimes. Sometimes we see an osteo to kind of help the baby use the jaw and the tongue and the mouth muscles a bit better. To kind of get them to lift a little bit more, get a good mouthful of breast tissue, allow that to happen. And if that still doesn't work, despite the positions and getting the baby's mouth wider a little bit, if that still doesn't work, then the next step will be to get the frenectomy if necessary.
Okay. And what proportion of women that you see who are struggling with supply, you feel like actually if they just had really good support, if they had someone there like you to come in and really, look at their latch and diagnose the problems that are really there, that actually would be able to continue breastfeeding and develop a good supply? How much of it do you feel is support and how much do you feel is kind of
physiology.
Yeah.
Um,
I suppose those two things are interconnected, aren't they?
two very
It's like a
difficult
virtuous
things.
circle. The more support you have, the better your physiology. And
Not necessarily. Sometimes, the more support you have, the more you accept sometimes that you might not have the anatomy or the physiology to do things, but you will still try and give it your best shot.
Okay. So what types of anatomy, when you meet a woman, you go, oh, this is not going to be good.
Okay. So sometimes when I see a mom with a very wide space between their breasts, we call that insufficient glandular tissue.
Okay.
That might be an issue. Sometimes we have, the nipples kind of point in different directions. That's all part of that whole paradigm, right?
Right. Okay.
The IGT. Sometimes women have inverted nipples, and that can be a bit of a challenge as well. Some women would have had breast surgeries, augmentation, reduction surgery, sometimes for aesthetic purposes, sometimes really just because they already had issues with the size or the shape of the breast, and then they would have gone through some surgeries to assist with that. Those would be the kind of moms who might have some issues with breastfeeding.
So if they've got an inverted nipple, what can you do about that?
Prior to the baby actually arriving, there are certain things that we can do, just kind of helping coax the nipple out.
Right.
We use different tools to help with that. Sometimes just the hands might be good enough. And usually just with that, during the course of the pregnancy, the nipples start to evert anyway.
And they stay?
And they stay sometimes.
That's amazing.
Yeah. But we sometimes see the true inversions. And in those cases, using the shields might actually be helpful too. Because babies effectively don't nipple feed, they breastfeed, right?
Yes.
So as long as the baby has got a good tongue anatomy and can use your tongues to kind of hold on to the areola, then that's done, done and dusted. Babies will be able to feed much effectively.
Okay.
Yeah.
And tell us about breast augmentation, either enlargement or reduction. How does that impact on breastfeeding usually?
The type of surgery that's done will have an impact, right? So if they have actually done cut out the areola and stick it back in a random place, that will be an issue.
Okay.
Right? If there's a very large amount of breast tissue removed, like a lot of the milk glands, milk producing glands, if that's all removed, then that might be a challenging issue because moms might not be able to make the milk that they needed.
Yeah.
There's certain types of surgeries, and like the inferior pedicle might be a little bit easier to breastfeed with because there's not so much of a shift in the areola. Although having said that, some of the ducts would have been severed already during the process. The length of time between the surgery to having the baby, the longer it is, the more time that mom would have to recreate those ducts as well.
Right. Okay. That's really interesting. Now, let's go on to supplements because often when women are struggling with their feeding, particularly if they don't have the support of someone like you, they will turn to supplements like fenugreek and lots of other ones. How effective are those?
This is a tricky question because so many women are on these supplements, right? I often find that there's a lot of placebo effect in there.
Yeah, which, that's fine. As long as it's not doing them any harm.
Right, yeah. But that's mostly it. I think it's really just a placebo effect.
Okay. So there really is no evidence that they were. Okay.
Not really. Fenugreek potentially, but we haven't gotten any really good quality studies on fenugreek and the milk production rate at the end of the day. We know that there are certain medical grade supplementations like domperidone and metoclopramide that seem to work to help make more milk.
Yeah.
And that can be something that we work with sometimes when moms have got a perceived low milk supply or an actual low milk supply.
Okay. So tell me your checklist then. So you've got a mum who's coming in, she's got a perceived low milk supply. So you're going to be asking her, okay, is this real? Is baby peeing and pooing? If they are, you're not really worried about that. If they're not, and you're not worried about baby acutely, you're going to be talking about things like the latch. You're going to be talking about positioning. Yep. You're going to be talking about frequency of feeding. What else are you going to be talking about?
Yeah. So we know that moms actually make the most amount of milk between the hours of 11 p.m. and 3 a.m. So that's when prolactin's maximally produce, and that has an impact on the milk supply for the rest of the 24 hours when milk is removed during those hours. So if a baby were to feed through the night, and we're not sleep training, for instance, we're allowing the baby to latch on as much as possible, or we are pumping, we're waking up to express that milk during those hours, we can safely say that these moms are going to be making enough milk for their babies over the next couple of days. Okay, so that's my checklist basically. Okay. So how often is baby eating? How often is milk being removed? How many pees and poos? How old is this baby, of course? Is the baby's latch quite good? Is the mom comfortable? Is the mom supported? And then we look at what else is happening. What was the birth like? Right? How much blood loss did she have? Did she have any pre-existing mental health issues? Is she on any medications for that? And how much pain is she in?
Yeah. How often, when you've done that full checklist, do you get to the point where you go, no, you need some metoclopramide, you need those medications that actually increase? How often, in what proportion of patients are you prescribing those?
Not as often, but then again, I do see a very niche type of patient, right? So I do see the patient or the client who has seen a lot of other lactation consultants and then have decided that, hey, I think I need to go see Mythili, right? So I think maybe about 10, maybe less than 10, maybe 5% of the population of the moms that I see would come to me to get some domperidone.
And how effective is it, the medication?
I think it actually is quite effective. I see it, most moms getting at least 30 to 50% increase. And that can be quite significant for a mom who might be producing 60 mils and then she starts producing 90. And that might be all that the mom needs. Or all that the baby needs at the end of it. Metoclopramide, on the other hand, we don't use as often because it does cross the blood-brain barrier. Domperidone doesn't do that. It has quite a few side effects as well, right? So it does have an impact on the gut. It actually does increase the gut motility. So moms would find that they're using the toilets a bit more.
Okay. But it sounds like getting to that point, if you ask for, you're seeing an expert, actually there are a lot of other problems that probably come way above needing to be on a medication like that. That's it.
Anyway.
For my third child, I gifted myself a night nanny. It was amazing. I always wondered whether it did affect my milk supply, though, because I went back to work with my little one at 2 months. It was very, very early. And that definitely affected my milk supply.
Oh, yes.
But what do you think? I mean, lots of women do that these days, and who can blame them for that? What is the effect of reducing significantly the amount of either pumping or feeding that you're doing at night?
Well, it really has an impact on the milk supply. It actually does drop quite significantly. Even pumping versus babies feeding at the breast has an impact, right? Because you love your baby, but I don't think moms would say that they love their breast pump the same way.
They're so noisy.
Well, it's also a mechanical
You feel
thing.
Like a cow. Yeah,
That's
it's horrible.
No, but kudos to those moms who are doing this exclusively. They can't breastfeed or they choose not to, and they just really pump and get the milk for their babies. But right. So even pumping might not be as effective or efficient. And so that has an impact on the milk supply at the end of the day as well.
So as a breastfeeding consultant, so you're seeing women all the time who are coming to you probably quite stressed that, they don't have the supply and they want to improve it. At what point do you say to them, look, enough, let's stop? I don't know what your experience is, and maybe with the use of medication, actually, you don't need to do that. But certainly sometimes in my experience, sometimes when women are coming in to see you, it's almost as if they're looking for permission, as it were. Everything's got too much. They've kind of decided in their minds that they want to give up, but they feel guilty. And they come in and they're kind of looking for you to say, look, it's okay. And my view very much is, look, as a mother, you are the most important person in your family unit in terms of mental health. If you are good, everyone in your family is good. And if this is not working for you, let it go. What's your view, and how do you manage that with your patients?
So what I often talk about is I always remind them it doesn't have to be all or nothing. Right? So even if they could latch once a day or pump once a day and still provide that kind of reduces a lot of the guilt for the mom, right? And if that's still causing a lot of mental health issues and just allowing them not to be a mom or like a fully functional adult, then I say stop. It's just not worth it. I'm sure the baby would prefer that a mom is actually a happier mom than to push through with breastfeeding sometimes.
I totally agree with you. Yeah. Good message. Okay, so let's move on to the mother who is going back to work.
It's never enough time with the
never
baby.
Enough time,
it's never
right?
enough.
It's never enough time. And there's always this anxiety, particularly if you have been breastfeeding and you've done it all the way through. It's quite anxiety provoking. I remember with my first child, she would not take a bottle for love nor money. She would not drink from a cup, nothing plastic. Nothing plastic was allowed to go anywhere near her mouth.
Wow.
And it was really, I got very anxious about it. In the end, of course, needs must. And when I wasn't there, she took a cup and she did drink, and she didn't just wait for me. But it can be very anxiety producing. What is your tips for women on going back to work?
I would often recommend that if you know you have to go back to work at about 4 to 6 weeks, start by pumping a little bit. Provide a bottle and get the baby used to the bottle. And if you choose not to use a bottle, a straw, a cup, a syringe, all of those things actually work quite well as well.
Straw? Can they suck a straw?
They can. Because it's the same mechanism, really. So I got my babies to start.
I never knew that.
It's the same cheek, tongue, jaw mechanism.
How old? Like really young? Four weeks old can suck a straw?
You can.
No
It
way.
has been done. You can try it. Right? You just have to mimic and just practice and keep practicing.
Yeah.
My babies never took bottles.
Yeah,
and so they had to use straws, right?
Yeah.
But they got the milk. They were fed. They were quite chunky at the end of it.
Yeah.
But
Yeah.
and that's always something you can think about.
Okay. So it's about preparing early.
Preparing early, knowing that you've got to go back to work and, getting yourself sorted, really.
Yeah.
Finding the caregiver that you're feeling confident leaving the baby with as well. Very important because moms often forget that, right?
Yes.
And getting the right clothes, getting the machines that you needed, getting a good quality double electric breast pump and always double pumping, because I find so many moms are single pumping, right?
Yes.
And then the other breast is leaking while you're pumping one. Just put both of them on and pump always double. And that gets more milk out anyway.
Absolutely.
And then getting the right support, but also finding the community that actually works for them, right? So, even if the workplace might not be the most breastfeeding friendly, where you needed to take time off and pump or store the milk, find someone else. I'm sure there'll be someone else in the building who would be pumping and storing the milk as well, and make friends and get some equipment ready for yourselves.
Yeah. That's a really good advice. What about weaning? So again, I think this is another one that if you have been breastfeeding, it might, cause some anxiety. Your child's going to be really upset and have tantrums and cry a lot, particularly if they're over 1 year old. And I'm sure that there are some mothers who worry that they're damaging their baby by kind of psychologically damaging their baby by kind of refusing, but they're kind of at the end of their tether and they really want to stop. So what are your tips for weaning?
I think moms need to know why they're weaning first, right? So if they know that they have to do this for themselves, for their babies, because they're going away, for instance, then, know why you're doing it, and then try and explain it to your child. I know it's hard to explain anything to a 1-year-old, but try and find something else. So if you're removing the breast as a source of comfort, we need to replace something else.
Yeah.
Right? So maybe it could be a hug, it could be story time, something new, really. A new toy, for instance, or just distraction. I mean, it's not the most ideal situation, but I think it might work, right? And offering a bottle, providing lots of love, all of those things tend to work quite well.
Yeah.
And knowing why you're doing it. I think I can't stress that enough. Once you know that you're doing it for a good reason, for the baby and for yourself, then it just gets a lot easier.
Yeah, absolutely. Let's do a little bit of myth busting, because there are kind of a few controversies around breastfeeding. I would like to get your opinion on it. So breastfeeding and postnatal depression. There are schools of thought, or some women out there who think that breastfeeding increases their risk of postnatal depression. I've heard about it certainly with abrupt weaning, that can cause postnatal depression or trigger it anyway. And then there is evidence, of course, that it actually doesn't. And there is evidence that it's actually protective. So what's your view?
I think if there has already been a lot of mental health issues prior to the baby arriving, then we must be very careful about postpartum depression, postnatal depression. I often find that it protects if breastfeeding goes well. If it doesn't go well, then it can be a source of issues and might trigger the depressive symptoms all over again. So it is all about the support, getting the right help, getting to know if it is working or if it isn't working and finding peace with it.
Yes. Is the physiology of breastfeeding what we talked about in terms of, the hormones involved? I think that's maybe one of the things that people worry about when they think, oh, I'm not sure if I want to breastfeed. Maybe I've got a history of depression. I'm worried about all the extra hormones making me more susceptible to an episode of depression. Is there any evidence that that kind of physiology impacts on mood?
Not really. I think the oxytocin is very protective against postpartum depression. That prolactin, the oxytocin cascades all really help with the bonding, security, attachment, and feeling of belonging that is super protective for mums if it goes well.
Yeah, exactly.
There's always a caveat there.
Absolutely, absolutely. Okay, what about breastfeeding is associated with a higher IQ in the baby?
Ooh, I don't think that's entirely true. Again, we haven't done enough research on this. I think if a baby is born to a family that's loving, supporting them, allowing them to grow the way they want it to grow, and, just allowing them to have all of the resources that's available, that protects IQ and that increases IQ. I don't think that's a huge link between breastfeeding and IQ, and I don't know.
No,
it could be socioeconomic statuses.
Absolutely, I think
so many biases. Yeah.
Okay, and last one: small-breasted women cannot breastfeed.
Oh, not true at all. I've seen so many women with tiny little breasts who actually have a significant milk supply. I've seen babies come off the breast with milk flooding their faces.
Really?
It's really cute. It's incredible.
Aww.
Yeah. And then you also have the large-breasted women who might not have as many milk-producing glands in there as well.
Right.
So it can vary so much. It's the size of the breast actually is determined by the fat cells around them, not so much of the milk ducts.
Right.
But the shape of the breast could differ as well with the insufficient glandular tissue. So yes, small-breasted women, it doesn't mean that you can't breastfeed.
Okay, awesome. Mythili, thank you so much. I think we have managed to pack in a lot to 45 minutes. We could definitely, I'm sure, come back for many more episodes to get into it in much deeper form. But just tell me your takeaways. What do you want women at home who are kind of about to embark on this process? What do you want them to know?
I want them to know that if they already had something pre-existing, that they're thinking, hey, I'm not sure about this whole breastfeeding business, seek help early. Get in touch with an IBCLC, speak to them about your concerns and find out whether that's actually an issue or it's not an issue. But also get the childbirth education going before the baby arrives, because that actually gives them the empowerment to be able to birth the way that they wanted to birth. Right? Or at least know what's out there for them. Because the hospitals can provide what the hospitals can provide. But there's so many other options out there that they might not be able to have. Right?
Yeah.
And so get the childbirth education going early. Know what breastfeeding is all about and what are the issues that they might face. But also know the basics of it, because that's how you get your armor going.
Absolutely. Is there a breastfeeding or lactation consultant registry? Is there somewhere you can go on and find?
Yep. So the IBCLC online, you can actually search who are the lactation consultants out there in Singapore. That's a good way to start. Or just Google search. There are quite a few of us around in Singapore right now.
Yeah. Okay.
Yeah.
And last point, one of the things that breaks my heart really in clinic is when you see women who really, really wanted to breastfeed and for whatever reason they've had to give up and they do feel really inadequate. When you see these women, what are you saying to them? What's your message to these women or anyone out home who feels that way? What's your message to them?
Breastfeeding is not just the transfer of milk. Breastfeeding is the transfer of love and comfort and security and all of the other things. So we sometimes call it chest feeding, where you're actually being skin to skin with your baby and giving them a bottle. And that's also breastfeeding, I feel.
Yeah.
Right?
Yeah.
So I think there's so much more to breastfeeding than just milk.
Yeah. That's lovely.
Yeah.
Really lovely. If I were hearing that at home as a mother who was struggling to breastfeed, I would take heart from that. Thank you so much, Mythili, for coming in. And that's it from us at the Women's Handbook podcast.
The content of this podcast is for educational purposes only. It is not intended to replace the doctor-patient relationship, nor does it constitute personalised medical advice. If you are affected by any of the topics discussed, please speak to your doctor or a qualified healthcare professional.